Well, it's exciting times because the genomics of Waldenström is telling us a lot about how we should be treating patients, but also giving us insights into new therapeutic opportunities, both targeting MYD88, which is the most important mutation in Waldenström's that we see in over 95% of patients, as well as CXCR4 that we see mutated in about 40% of all patients, has given us new therapeutic insights. And so developing inhibitors that actually shut down MYD88 pro-survival signaling. And the same for CXCR4, being able to see the development of CXCR4 antagonists has been really a joy seeing this evolve, in real time, and certainly being discussed at great length at this meeting. Well, I'm excited about my talk on targeting CXCR4 because what we've learned from at least 2 studies so far is that it's feasible, particularly in the context of BTK inhibitors, which we know are impacted by mutated CXCR4.